Let's get some more analysis from Angelique Coetzee, who's in Pretoria, South Africa. She's an advisor for the Solidarity Doctors Network, also a former chairperson of the South African Medical Association. Angelique, thank you so much indeed for your time. Could you just tell us how South Africa has dealt with BA.4 and BA.5?
Good morning. At this stage, I think BA.4 and BA.5 are dealing with us. But luckily, we are in the midst of our winter. We have seen a lot of flu-like infections, upper respiratory tract infections. But interesting enough, not a lot of BA.4 or 5 this past few weeks. Not sure why that is. As I've said, the symptoms of BA.4 and 5 very, very similar to COVID, to flu-like symptoms. The problem is we can't test everyone. The medical schemes, which a lot of people belong to, only pay for 2 tests a year. Then we are also struggling with getting people tested at the healthcare clinics or the public healthcare clinics. So I think we are missing a lot of COVID-19 cases due to practicalities around this. But again, I think the saving grace is that BA.4 and 5 in South Africa are currently, again, giving mild symptoms, not really affecting our hospital admissions as well as ICU admissions. Not sure, again, why South Africa is seeing less cases admitted to hospital if you look at US and in Europe. But that is what we are seeing currently.
So we've had Alpha, we've had Beta, we've had Delta, which was particularly deadly. Now we've got Omicron. Angelique, are you at all encouraged by the fact that we haven't gone beyond Omicron yet? We're still talking about Omicron variants when we mention BA.4, BA.5.
For now, yes, but I'm still concerned going forward within the next 5 to 6 months what is going to happen. This variant is not to be trusted. I'm also aware of the fact that you could have had the Omicron itself, and about 4 weeks later you can have B.4, B.5. So there's definitely a decline in the immune status around antibodies. Again, mostly in mild diseases. So anything can happen going forward. South Africa, unfortunately, not very well vaccinated. And that might lead to a different strain coming out and not subvariants. So we'll need to see what is going to happen within the next 6 months. I'm not really optimistic that we are past the pandemic. I don't think so.
Do you think the level of vaccinations in South Africa are at all reflective of the bigger picture across the developing world? We heard in that report that only 20% of the developing world has had at least one shot. And 2.5 years ago, when this whole thing started and then the vaccine rollout began, people were saying that if we don't vaccinate the whole world, nobody is going to be safe.
Yes, I still stick to that. South Africa's vaccination rate is actually much better than the rest of Africa, which is actually poor. And again, the data of Africa, leading to the impression that there is not a lot of cases in Africa. I don't think that is true. Again, I think there's a lot of reasons why it's underreported, and you cannot really go and say Africa didn't see the brunt of this pandemic. It's more Europe and USA. It's not true. I don't think so. There's a lot of deaths that are unaccounted for regarding the reason why they died. Africa is a difficult place to look at stats, data, especially with the COVID. I don't know whether we can be sleeping sound and safe at night if we know that Africa is really not being vaccinated.
Angelique, as I said, thank you so much indeed for your time. Your analysis is really important in helping to keep people safe. Angelique Coetzee in Pretoria.